I worked for 30 years doing epidemic investigations and looking at chemical effects on people, air pollution, a whole series of issues. And about 10 years ago, while I was at the Centers for Disease Control and Prevention, I became really engrossed, almost obsessed with the fact that we have built America in a way that is, I believe, fundamentally unhealthy.
How many of you are taking medicine for asthma?
To see your son not be able to take a breath is one of the hardest things I've ever had to deal with. Every parent out there whose child has asthma understands how I feel.
We could not have designed an environment that is more difficult for people's well-being at this point, particularly as we look at epidemics of obesity, diabetes.
Diabetes, not a good thing to fool around with. I went in for some treatment. They said I was going to take my foot off.
With young people that I work with, the population that were obese are now heading towards morbid obesity.
We're looking at the first generation in American history to have a shorter lifespan than their parents. In 2001, members of Congress thought that I should be fired because I dared suggest that how we were building America might be bad for our health, might be making us overweight, unfit, depressed, and lonely. In 2001, my views were considered so controversial they almost got me fired. Today, they are at the center of a provocative new television series, now being broadcast on public television stations throughout the United States. Designing Healthy Communities is a 4-hour mini-series and companion book based on my extensive work in the field of public health. You and the folks that are providing people good and healthy food, you're more a doctor than I am. As a practicing physician, author, former director of the National Center for Environmental Health at CDC, and current professor and chair of environmental health sciences at UCLA. I'm a professor at UCLA, but my passion is how we build where we live and how it affects people's health, and why we need to rebuild all the places that we live in ways that make us all better, young, old, and everybody in between. Too big a topic to be contained in just one program, we traveled around our nation filming in communities large and small with a vast variety of design and health-related issues. Each of the 1-hour episodes tackles specific problems and offers realistic solutions that will promote better health and enhance the overall quality of our lives. On the first of 4 episodes, the time has come for the retrofitting of suburbia. We will see communities that are combating the causes of type 2 diabetes, not through medication and amputation, but by redesigning our car-centric society. The second episode gives insights on rebuilding places of the heart. We visit cities struggling to resuscitate their dying downtowns, where the polluting sins of past industries haunt the future.
This lake is a Superfund lake, the only Superfund lake in the United States.
You look at the problems and you recognize them and you grieve over them, but at the same time, you look and see what can be done and you do your best to help.
All across our nation, young people are working to better their cities and neighborhoods by redesigning places of the heart. Social Policy in Concrete is our third program.
Differences in life expectancy between the poorest neighborhoods and the wealthiest neighborhoods exceed 10 years.
And we tell people in our county, give me your address, I'll tell you how long you live.
We see how low-income neighborhoods are affected by pollution and how the city of Detroit struggles to save itself.
And today, we are ground zero. We are the New Orleans without Katrina.
On the last episode, I go searching for Shangri-La. Can the perfect community exist?
It would be a place where kids would feel safe and senior citizens could walk and feel like they were protected and well thought of.
We seek to find perfect communities, large and small, past and present, that embody the intricate balance of health-promoting design and the human needs for fulfillment and happiness.
When you come home, you want to feel a sense of haven, and that's what people feel here.
In addition to the series, together with educator Stacy Sinclair, Dr. Richard Jackson has written a companion book that offers in further detail the root causes of our national health crisis and highlights community design solutions to these problems. Dr. Jackson was recently honored to be the sole guest interview on the PBS nationally broadcast Tavis Smiley Show.
And for too long we've been worrying about things far away or very minute. And it was time to think about designing and building places that work for people.
Let's hope that message gets through, and I'm honored to have you on this program. Thank you for the work that you are doing, and all the best to you.
Thank you, Tavis.
Here's what people are saying. In her health column in the New York Times, Jane Brody wrote, "The 4-part series that Dr. Jackson developed highlights changes being made in forward-thinking communities, changes that foster better physical and mental health by redesigning the built environment." Paul Goldberger, architect critic for The New Yorker, declared, "You wouldn't expect a doctor to write one of the most important books about planning towns and cities, but that is exactly what Dr. Richard Jackson has done." And from Bart B. Sokolow of Environmental Advisors Incorporated, "You have a winner, poignant and to the point. I hope it becomes a vehicle for change. People can view these programs and say, we can do that." And that's what we hope too. We intend designing healthy communities to be a positive catalyst, the beginning of a movement that will lead to significant change all over our nation.
Watch my new mini-series, Designing Healthy Communities, as we seek to improve our national health